Hi, I'm Marty Cohn, and welcome to episode 6 of Grace Cottage Hospital's Healthcare Matters, a monthly show that brings you timely information on health-related topics. Grace Cottage is an independent healthcare facility located in Townsend, Vermont, just 17 miles north of Brattleboro. Among its services are primary care, rehabilitation services, and 24/7 emergency service. Its mission is to promote wellness, relieve suffering, and restore health. In today's episode, we will be discussing something that brings nearly 3 million older Americans to emergency departments every year: injuries resulting from falls. Our guests are Ruth Fleming, a physical therapist who will share important information on preventing falls, and Jessica Emerson, Director of Social Services at Grace Cottage Hospital, who will let us know what you should consider if you or someone you care about actually does fall. Welcome, Ruth. Thanks for coming on the show. So, why is fall-related injuries such an important topic?
Well, part of it is we're all getting older. Baby boomers aren't babies anymore. People live longer. There's a normal process of aging, but then there are other conditions that become more prevalent just because we're getting older. The sad fact is that every 11 seconds, someone is in the emergency room because of a fall. And every 19 minutes, someone dies because of a fall and related injuries. 95% of all hip fractures are because of a fall. And what people forget sometimes is that traumatic brain injuries also occur because of falls and are a big part of some of the injuries that can occur. So it can be a lifestyle change, quality of life, can cause significant decline in mobility, and affect someone's ability to be independent in their home.
Wow. So do you see a rise in fall-related injuries this time of year?
You know, that's an interesting question because honestly, we can't say in the winter we have 20% more falls. Falls happen all year round. What we do see is that in the winter and inclement weather, people stay home more because they're afraid of falling. So then they start the process of becoming more debilitated, weaker, they're moving less, they become tighter, they become more susceptible to different disease processes that they might not have been if they'd stayed more active.
So what are some of the conditions that make someone more susceptible to falling?
Well, as we age, we do become more susceptible to certain disease processes, and not everyone. There's heart disease, cancer, there's diabetes, different types of acute illnesses people can be more susceptible for, like for pneumonia, which you wouldn't necessarily think of. And then Alzheimer's has become increasingly an issue. As we get older, it becomes more and more prevalent, which causes a decline in someone's functional mobility. Besides the weakness, you can have difficulties just maneuvering around the home, having to use an assistive device of some sort, or needing one and not using one. There are people who become more afraid to go out, which I think I touched on, and they have no other resources available for them. Or they may become very sedentary. They're sitting in a chair, that recliner, we turn into our recliners, or they're going to bed at 5 o'clock in the afternoon. They may not be eating right. They're not taking care of themselves. Simple things like hygiene may go out the window. Polypharmacology, where people are having to take all kinds of medications, and it's a gentle balance between everyone as long as they're taken correctly. And that's where it's so important that people are aware and understand what they have to take and why, and sometimes it's a time factor. And then as we get older, sometimes people don't eat. And you can imagine as you're losing weight, and again, it contributes to becoming weaker and even more debilitated.
Wow. So falls can happen indoors and outdoors. So what are some tips for preventing falls at home?
There's a whole variety of things people can do that are really simple. In the home, you get rid of clutter. That is something so simple. Those magazines on the floor, the garbage can that's in the way, all the furniture that might be in the hallway. You pick up scatter rugs. You try to tack down area rugs so that you don't catch them. If you're starting to furniture walk, that can be a sign that you might need some sort of an assessment to determine if you are qualified or if it's appropriate for an assistive device of some sort. Other things you can do are simple, such as lighting. Our needs for lighting increase dramatically as we get older. And you want to avoid all the shadows as well as glare. You want to be mindful of pets because they can trip you up, or just trying to take care of that cat litter. You may not be able to bend over as well anymore.
That's interesting. And outdoors, are there things that we should be looking at in terms of preventing falls outdoors?
Absolutely. Some people don't realize that just regular maintenance is an important part of preventing falls. Making sure that the pathways are clear. Being mindful where ice might occur with the changes in weather. Making sure that there's adequate lighting. Making sure that railings are secure. Railings are another issue inside and out. Making sure they haven't rotted, that the steps haven't rotted, that deck that you have to use where the railings are too far apart and you can't use them at the same time, try to make some accommodation if somebody needs two railings, or make sure they're using the one railing correctly.
So, so those are some physical changes and things that we should look at in our homes and outside. But do you have any suggestions for older folks to keep their bodies strong so that they can help prevent falls?
I think the important thing is just to keep moving. When we become sedentary, we're sitting in a chair, we're staying in bed, we lose all that strength, flexibility. Lower body strength is critical to staying mobile and just being able to get up and down from a chair, in and out of bed, up and down from the toilet. There are other things that are available to people, and part of it is speaking to your doctor to see what you might not or what might not be appropriate for you to do. You can do simple exercises sitting. It doesn't have to be lying on a mat or lying in the bed. You don't have to have fancy equipment. If you have that stair glide, or not the stair glide, if you have an elliptical or you have a treadmill, check with your doctor, see if it's safe for you to use. If you want to join a class, such as yoga, Tai Chi, or strong bones, those are available. Those happen to be available at Grace Cottage Hospital.
Well, so those are all good. Now, I've heard about something called a fall prevention program. Is that? But I'm not quite sure. What is a fall prevention program?
That is where there's an assessment of an individual. Maybe they're afraid of falling, or they've had a fall, and they've spoken with their doctor and they're interested in learning exactly what their risks are, where they're vulnerable, and what might be available or what could be done to help prevent that. And through this at Grace Cottage, we involve physical and occupational therapy to look at a variety of areas: strength, balance, endurance, flexibility, and function. Depending on what their abilities are, can they do basic things around the house, like getting in and out of the tub? Many people stop using the tub because they're afraid of falling.
Right.
And once an assessment is done, there may be outpatient services that are appropriate for that individual, but that's very much on an individualized basis and working with the person's doctor.
Great, great. Well, Ruth, this is all just great information to have. Thanks for taking the time to be on the show.
Happy to.
We'll be right back with Jessica Emerson, Director of Social Services at Grace Cottage Hospital, after this brief message from the American Association of Clinical Endocrinologists, because after all, you have to remember, January is Thyroid Awareness Month. We'll be right back.
Every day, your neck gets attention. But is it the kind of attention that could save your life? 30 million Americans suffer from thyroid disorders, but 15 million don't know it. Do you battle with fatigue or forgetfulness? Do you experience problems with weight? Or is daily anxiety just too much for you? If your thyroid isn't working properly, neither are you. It's time to check your neck. Thyroid disorders tend to run in families and are most common in women. Thyroid cancer is one of the fastest growing cancers in America, but one of the most curable. Visit thyroidawareness.com to find out how your thyroid gland influences the function of many of your vital organs. The American Association of Clinical Endocrinologists wants to make sure your neck gets the kind of attention it needs. Please visit thyroidawareness.com to learn more. It could change your life for the better.
We're back with our next guest, Jessica Emerson, whose full title, I want to get this right, Director of Admissions, Discharge Planning, and Social Services at Grace Cottage Hospital. Welcome, Jessica.
Thank you.
I wanted to get that title correct.
Thank you.
All right. So we just heard from Ruth how to prevent a fall, but what if someone does fall? So let's start with what someone might do if they fall at home with a, let's say, minor injury. What should they do?
Okay. So if it's a minor injury at home, a couple of avenues an individual might take. They may need to consider going to see their doctor, or if it's a little bit more of an injury, going to the emergency room. But let's say it's a more minor injury. So they make an appointment with their primary care provider. And at that appointment, they usually are making all kinds of assessments, but usually what comes out of it is perhaps a recommendation for physical therapy and occupational therapy to help address any strength or balance issues which may have contributed to the fall. And of course, at Grace Cottage Hospital, we do have outpatient physical therapy services. If an individual has a harder time getting out of the home, though, it may be recommended that home health go to the home and provide physical therapy services if they qualify. Another recommendation might be, as Ruth mentioned earlier, a fall prevention program such as Strong Bones or Tai Chi.
Wow. Okay. So that's just for a minor injury. But what if it's a more serious and requires, I don't know, maybe overnight monitoring with in the hospital?
Sure. If someone needs to go to the hospital to be monitored, at the hospital there is an interdisciplinary team that will be assessing and working with the individual, which usually is made up of a hospitalist, an RN, a physical therapist, and care management. The team together will be working to decide what the individual's baseline independence was, what the home supports are, and how the home might be set up, and helping to identify any risks that may need to be addressed at home.
Wow. Okay. So, but what happens? I'm giving you all these hypotheticals here, but what happens if the injury is worse and the person has broken a bone or needs surgery? I have my mother broke her hip. I mean, it was but what's the protocol there?
Sure. If someone needs to be hospitalized for a more major injury, the condition's treated, maybe the surgery's been performed. Again, during that hospitalization, an interdisciplinary team is going to work with the patient and their family to identify whether or not after the surgery an individual is able to go home with supports, home health, outpatient services, and family supports. Or if the individual hasn't quite gotten back to their baseline of independence or being able to mobilize well enough to go home, it may be considered time to go to inpatient short-term rehabilitation.
Ooh, okay. Well, when I hear that, I think of money. So who pays for that?
So once it's determined that an individual is eligible to go to inpatient short-term rehab, which again would be determined by that interdisciplinary team. For Medicare folks, it's different for different insurances, but for Medicare folks, they need to be hospitalized for at least 3 midnights in order to pay for inpatient rehabilitation. For other insurances, you may not necessarily need to be in the hospital for 3 midnights, but there's a key factor for any insurance, Medicare or private commercial, and that is that an individual requires skilled care on a daily basis. And the definition of skilled care is a nurse maybe needs to administer IV antibiotics twice a day, physical therapy needs to be performed daily, as well as occupational therapy, in order to work towards being more independent with your activities of daily living and a safe discharge. Some insurances may even require a prior authorization before entering and going to the inpatient rehab facility, which the care management team would work with the patient on. The best advice, though, for any patient is to call your insurance company or have your family help you call the insurance company so you know a little bit in advance what you may be facing.
Call in advance of just to have the information?
In advance of making any decisions, even while you're hospitalized, maybe before you're hospitalized, to be well educated on your options for inpatient rehab payment.
We a couple of shows ago, we actually talked about, you should know what your health care pays for and before you need it. So that's solid advice. So the person who has to go to a facility for rehabilitation, who determines when the patient goes home? How does that happen?
Sure. So once an individual has decided where they're going to go, and we'll back up a little bit, and when they're in the hospital, care management will work with them on giving them choices for any facility in the geographic area that they live in. All the nursing homes in the area provide skilled care, and at Grace Cottage Hospital, not only do we provide inpatient rehabilitation services, we also have our acute hospital care beds as well. So when an individual comes to us for inpatient rehab, right away, an interdisciplinary team is working with the individual and their family to identify any goals that need to be met for a safe discharge home. So, for example, somebody may need to be able to walk up 4 steps to get into their home. Someone may need to be able to walk household distances of 100 feet. And they may need to be able to get in and out of their bed independently because they live alone. And as Ruth mentioned earlier, several other areas might need to be worked on, such as accessibility to the home. So once an individual is in line with meeting their goals, that's when we're talking about readiness for discharge.
And so then the discharge would be to their home, but what kinds of support happen after their rehab stay? I mean, to provide, like a continuity of care for the patient.
Sure. Preparing patients and families for discharges is a key factor in successful transitions to home. And it starts as soon as someone enters the facility so that preparations can be done in advance as much as possible. Generally, at Grace Cottage Hospital, folks might transition from our inpatient rehabilitation program to our outpatient rehabilitation program. If an individual is still having a hard time maybe getting out of home, they're still recovering, at that moment we might instead refer them to home health to go into their home until there's a time where it's not as hard to get in and out, and then they may graduate to the outpatient program.
So the outpatient program, this is some outpatient rehabilitation services that they would be eligible for even though they're at home.
Correct. So an individual, if they're at home but they're still needing to progress with some physical therapy, occupational therapy, then their doctor would make a recommendation to continue that therapy in the outpatient setting. Other areas that we work on to identify for successful transitions to home is the durable medical equipment or assistive devices. So wheelchairs, ramps, walkers, oxygen, all of that would be set up with your care management team prior to discharge. If someone is more homebound, we might be looking at services such as Meals on Wheels, adult day programs to help engage with participating and being active on a daily basis, or even emergency response system, I've fallen and I can't get up.
Right. So all of that happens with this care management team in consultation with the patient so that they know what services they have. And is this also something that is covered by what you meant, the health insurance and
Sure.
Medicaid and Medicaid?
Absolutely. It's a part of the package.
Wow.
Care planning and interdisciplinary team planning with patients is absolutely a part of the package.
Wow, that's just a fantastic service. Jessica, thank you so much for giving more information than we have on this important subject. I would like to thank our guests, Ruth Fleming and Jessica, and a shout out to Roland Boyd, who is doing all the magic behind the camera. I want to also thank BCTV for helping us bring this show to you. If you have any questions, concerns, or even ideas for future shows, send them to info@gracecottage.org. That's info@gracecottage.org. I'm Marty Cohn. Thanks for watching.